Where is the urethra in the urinary bladder structure? Have you ever wondered where the urethra is located in relation to the urinary bladder? Understanding this connection is important for grasping bladder health and function. The urethra begins at the internal urethral orifice, which is an opening situated at the base of the urinary bladder. This orifice acts as the exit channel for urine, allowing it to flow from the bladder to the outside of the body. The urinary bladder itself is a hollow, muscular organ found in the lower abdomen, just behind the pubic bone. From the bladder, the urethra extends as a muscular tube, passing through various surrounding structures before it opens externally. At the bladder's base, the internal urethral orifice is guarded by the internal urethral sphincter. This muscle plays a key role in controlling urine flow. As the urethra continues, it passes through the pelvic floor muscles and is then surrounded by the external urethral sphincter, which provides voluntary control over urination. It is interesting to note that the anatomical path of the urethra differs between males and females. In males, the urethra is approximately 20 centimeters long and is divided into four distinct parts. The first part is the proprostatic or intramural urethra, which runs from the internal urethral orifice through the bladder neck into the prostate. Next is the prostatic urethra, which passes through the prostate gland. The third part is the membranous urethra, which goes through the deep perineal pouch and is surrounded by the external urethral sphincter. Finally, the spongy or penile urethra runs through the penis and ends at the external urethral orifice located at the tip of the glans penis. In contrast, the female urethra is much shorter, measuring about 3 to 4 centimeters in length. It extends from the internal urethral orifice at the bladder base, passes through the pelvic floor and external urethral sphincter, and opens externally between the labia minora, just in front of the vaginal opening. Understanding the position of the urethra in relation to the bladder is crucial for bladder health. The internal urethral orifice and the sphincters are vital for maintaining continence. Any tumors or abnormalities in this area can significantly affect urinary function. Additionally, the shorter length of the female urethra contributes to a higher susceptibility to urinary tract infections, which can impact overall bladder health. In summary, the urethra is anatomically located at the base of the urinary bladder, starting at the internal urethral orifice. It serves as the pathway for urine to exit the bladder and the body. The structural differences between males and females influence both function and clinical considerations, making this knowledge essential for understanding bladder health. Always consult healthcare professionals for personalized medical advice regarding bladder health and function.